All right, so in this video, we are going to review the seated trunk rotation test. Now this test is going to involve general motion of the lumbar and thoracic spines, but the main area we're testing here and the bias of the test is really going to be towards the lower thoracic and the thoracolumbar junction. So in this video, we will review the test itself, and then we'll talk about some treatment options and some really effective stretches and exercises to help address any issues that we may find. All right, so let's review the test itself. Now remember, this is a test of trunk rotation or spine rotation, and there's a few things we want to do to try to help isolate motion to the spine as best as possible. So first, from the starting position, we are going to perform this from a seated position. This is going to help limit motion through the hips and through the pelvis. And the other thing we're going to do is we're going to use a stick or a dowel placed across the shoulders here. And we're just going to hold that into the shoulders. This holding of the stick is going to limit motion through the shoulders and through the shoulder blade. And as we'll see in a moment, we're also going to use this stick as a measure or a proxy for how far that spine and that trunk is rotating. All right, so from this position, we're simply going to rotate as far as possible, trying to keep that spine tall and straight, as far as possible to the right. And we're going to make a note of how far the stick has rotated. And then back to straight, and we're going to do the same thing to the other side, rotating to the left as far as possible, get to that end range, and we're seeing how far that trunk and how far that stick is able to rotate in order to measure the degree of trunk rotation. Now the other thing we can do is we can actually measure the angle of this stick. Whenever we can put a number on a measurement and quantify it, it's going to be much more effective, not only to assess the motion in this moment, but it also serves as a nice comparison over time to see how that angle and how that range is changing. So to do this, I'm just going to place a digital goniometer onto this stick, all right? But keep in mind, an app on your phone also works really well for this. So we're just going to take a starting measurement. Then we're going to turn as far as possible to the, in this case, to the right. And I'm simply making a note of the angle of that stick, which is our representation of the rotational angle of the trunk. All right. And again, we can do this both directions. So turning to the left. Again, I'm just putting a number on that measurement or quantifying that angle so we know how far that trunk is rotating. All right, so now that we've gone over the test itself, let's talk about how to interpret and score the test. So first off, let's remember that these tests should not hurt. So if you feel like this test is limited because the motion is painful, as opposed to just feeling stiff or tight, this should really be addressed by a clinician or a therapist. But if the motion is not limited by pain, we can then score the test using our 4-point grading system. So what we can do here is we can take each of our measurements for right and left rotation. Remember, this is going to be the measurement we took at the end range position of both right and left trunk rotation. And we can see where these measurements fall within our grading system. And this will help to tell us whether the range of motion is normal or if it's insufficient and something that we may need to address. So here is our 4-point grading system. And as we can see here, under normal circumstances, the spine should rotate 55 degrees to each side. So if the range of motion is 55 degrees or more, this would be an ideal score and be representative of adequate spine rotation. Range of motion measurements that are between 40 and 55 degrees would represent a mild limitation, but in many cases we may not need to be overly concerned here. So we want to maybe think of this like a blood pressure reading that is just slightly higher than normal. In many cases, this may be something to simply monitor as opposed to aggressively treating. But if there are going to be some other factors or some other risk factors or maybe a personal family history of heart disease, we may need to be a little bit more proactive with addressing even these slightly elevated tests. So with respect to the spine, if you have a history of back pain or injury, or if you regularly engage in activities that require more bending or twisting of the spine, or maybe you play tennis or golf that requires more rotation through these areas, then this slightly limited range of motion may need to be addressed. Now, if the range of motion is between 25 and 40 degrees, it starts to indicate that there is a much more significant limitation. And if the range of motion is less than 25, Now we're really seeing significant issues here. These scores are more representative of a stiff and dysfunctional spine, and this probably needs to be addressed. So now let's talk about what to do when our testing reveals restricted and limited motion. And here we know that stretches and exercises are going to be a very effective way to improve flexibility of tight muscles and restricted joints. But because the spine is such a complex system, one of the real challenges here is directing that stretch towards the specific muscle or joint that is restricted. So when performing these stretches and exercises for the spine, we do want to keep in mind that we need to be very specific and deliberate with our form in order to target the right area, but also keep in mind that manual therapy techniques like active release or functional range release can also be really effective to help target specific joint and soft tissue restrictions. So this may be something you want to consider as well. And just one more thing before we get to the exercises themselves. I just wanted to briefly mention that limitations with trunk rotation are very often going to coincide with limitations in thoracic extension. And what this means for us is that when we do see rotational limitations, we are typically going to prescribe both rotational exercises as well as extension exercises. Now, I've gone over a lot of these extension exercises in other videos, so I won't bother going through that in detail here. But for the rest of this video, what I want to do is review our trunk rotation mobility exercise progressions. So the first exercise in our progression is going to be our basic seated trunk rotation exercise. So here we're going to perform this from a seated position, and we're going to simply do this with our arms crossed, just like we did with our test position. Now from here, I'm trying to keep my spine nice and tall, and I'm going to simply rotate as far as I can one way. I'm going to really try to hold that end position, hold the tension in those muscles for a second or two, and then I'm going to rotate back the other way. Again, my shoulders are moving, but the motion is coming from rotation through my spine. It's also helpful here to really think at the end range to rotate just that little bit further to push into that range. And when we're rotating, we're really imagining and thinking about that motion happening through these lower ribs and through that kind of lower thoracolumbar junction that we talked about earlier. As far as we can. One way, hold for a moment or two, rotating back. The other thing that can be really helpful here is that I'm imagining that as I'm turning, there's a steel pole going straight down through my spine, and I'm rotating around that pole. I'm not allowed to bend forward or back or side to side because that would go through the pole or break the pole. I'm trying to keep nice and tall, rotating just in that one plane. All right, now our second progression is going to start combining rotation with more of a flexion extension as well as with a lateral flexion motion. Now this is important because the way a lot of these muscles are set up in through here, like the latissimus and the multifidi and some of these internal and external obliques, these have much more of a diagonal orientation. So they are definitely going to be involved with rotation, but they also have a lateral flexion or a flexion extension component as well. And so we want to start combining these motions to be a little bit more inclusive in order to help really target all of the tissue and all of the muscles and soft tissue around this area to normalize that rotational motion. So first off, if I want to combine rotation with flexion extension, we're going to perform our rotational holds with a flexion and extension motion. So again, we're going to start nice and tall, seated, arms across. We are going to rotate as far as possible within this left rotation in this example. From this position, I'm really trying to hold that rotational position. And while I'm holding rotation to the left, I'm going to try to curl forward, holding for a moment or two, and then I'm going to try to extend backwards. Again, I'm staying tall, and I'm trying to get that motion occurring through that lower thoracic spine and through that thoracolumbar junction as best as I can. Again, the key here is we're not just lightly into rotation, we are holding that position, holding tension through the muscle, going forward, going backwards. And then, of course, we could repeat, rotate it to the opposite side. Now that's flexion extension, but we can also perform a similar exercise or a similar motion, but utilizing lateral flexion. So starting, I'm going to rotate as far as I can to the left. Again, as we spoke about just a moment ago, we're really going to try to hold that rotation and hold that position and that tension, really trying to hold that end range of left rotation. Holding that position, I'm going to tip my shoulders. I'm going to try to bend, in this case, to the left. So now I'm rotated to the left and laterally tipped to the left. Hold for a second or two. Holding that left rotation, I'm going to then lean over to the right. And I'm going to perform some slow motions, tipping my shoulders and bending my spine to the side, left and right. In this case, while I'm holding that left rotation. And I could also perform the same thing, but to the opposite side. I'm going to turn as far as possible to the right, holding that right rotation. I'm going to tip to the right, trying to get that right shoulder down towards the floor. Left shoulder lifts up. Hold for a second. Holding that rotation still, I'm going forward. Left shoulder tips down. Right shoulder tips up. I'm trying to be very deliberate about keeping that motion through the trunk, through the spine, particularly through those lower ribs, and through that lower spine, lower thoracic spine, and thoracolumbar junction. And then in our final progression, we can perform what are called thoracic cars, which are controlled articular rotations. The idea here is that instead of isolating different planes of motion, we are trying to move those spinal joints in that tissue in more of a circular motion in all directions. So we'll start sitting tall. I'm going to rotate as far as I can to the left. Now from this position, I'm going to hold left. I'm going to tip my spine backwards so I'm extending through my spine. So right now I'm rotated to the left, extended back. Now I'm going to hold that extended position and I'm going to try to rotate to the right. So now I'm rotated to the right while I'm extended back. Now I'm going to hold that right rotated position and I'm going to flex my spine forward. I'm trying to bring my shoulders forward, back over my hips and my knees. Now I'm going to hold this forward position and I'm going to rotate to the left. So now I'm forward, rotated to the left, and I'm going to perform these circular motions. Rotated to the left, nice and tall, leaning backwards, holding back, rotate to the right, holding to the right. I'm going to rotate forward, flex forward. I'm going to rotate to the left, and I'm going to keep going in these circular motions. I'm going to really try to focus the motion at that thoracic spine, at that thoracolumbar junction. I'm really trying to go slow, feel the tension through the muscles all around my spine, through the ribs, through the front, through the back. And then, of course, we could reverse the direction. I'm going to go to the right, holding right, going back. I'm back, rotating to the left, holding left. I'm going forward. I'm going to repeat these circular motions going in both that clockwise and counterclockwise direction.